Thank you, Bunny. Thank you. Can you hear me okay everywhere? Yes. Oh, I can hear myself. So welcome and thank you for inviting me here. Thank you, Bunny, for a lovely introduction and for the long time collaboration that we had. I'm from Italy, so my accent will be here until the end of the workshop at least. It will not go away. And besides all those titles and big words, it wasn't too bad. I really have a passion for bringing people to actually play and express themselves through art material and make visual art, but also movement and psychodrama and role-playing and dancing and centres. And these are all the arts, and obviously always with music. These are all the arts that we use in the expressive arts. In most of the clinical settings, the easiest thing to do is to actually engage patients and caregivers and clinicians as well with, either from very simple collage and paintings and anyway with visual arts and maybe some clay, some clay hands-on processes. So today what we're going to do, I'm going to walk you through a presentation that I prepared, but I really, since you have all the notes and you have all the handouts in your material, I'd like to make it as quick as possible. Also, it's after lunch, so I want to actually get hands-on play with all of you. So it's going to be more fun. And also, you'll have the chance of actually, whether it's the first time or not, but actually experience it so that hopefully you'll benefit directly. And also you'll know, you'll get ideas and maybe bring something back to your workplace, to your patients, and maybe to your families, to the kids. And these are exercises that are so fun and so usable and portable and easy to do. So I want to start right away. The gist of this presentation, the gist of my work, my goal is to really show you that when we use the creative process and we make it easy, we build a trust with our patients, the patients get to know themselves better, we get to know ourselves better, and we develop that empathy that connects us. And on the patient side, it helps them definitely increase their mood, elevate their mood, and increase their resilience, which there is a lot of material proving that. And on the caregiver clinician side, that's why I wanted to make a proposal for both. On the clinician side is definitely helping us avoiding the typical burnout, avoiding the sense of being depleted, caring for somebody. And it's really increasing and boosting our own immune system. So it's really working for both. And I'm a big advocate, and I encourage and I want to recruit all of you to advocate for more hands-on, more expressive arts in your workplace. So the objective of these programs that I created collaborating with oncology nurses and with doctors and with the patients, I get feedback from the patients all the time. So I co-create these programs to enhance the quality of life. That's basically, I'm not, that's my goal, quality of life for our patients. And also being aware of the interaction of all the things that they go through. And the suffering that comes with the diagnosis and the treatments is really what creates a lot of complications, behavioral problems, coping skills, or maladaptive behaviors that people just do to survive in the short term. This is an example from one of my patients that work with me, and you know, it kind of exemplifies very, very, can you see? I'm sorry. It exemplifies the conflicts and the suffering that goes through. And one of the research comes from Emory School of Nursing about patients feeling hopeless and losing control. So why do we want to talk about resilience? Resilience in cancer patients have been studied, and the results gives us an idea that actually cancer patients have the same resilience as people that don't have cancer. So there is the variation is very, very minimal. But when the crisis, the healing crisis comes in, resilience needs to be boosted up, and they need to be helped with tapping into their own ability to cope and overcome. So what is resilience? Obviously, it's definitely a natural ability to bounce back. So that's what resilience is, Okay, I get the blow, but I can pick myself up with help. Elizabeth Edwards, I'm sure everybody is familiar with her, public figure, and that's why I wanted to bring the quotes that, she really had incredible courage, and she talked about resilience when she used the metaphor of adjusting the sails through a storm and moving on. All the characteristics of resilient people that several studies have brought to light are actually perfect to address and to talk about what art can do. Art kind of symbolizes what's going on in life. And everything that you see in this list of characteristics can be addressed and played and lived through art. And we can go back and forth and see something in art, in our creative output, that can tell us and teach us how to be more resilient. So, if you make a mistake in art, I always tell my patients, it's not a mistake, it's an opportunity. You can do something different. You can do maybe something that you weren't thinking of and move on to something else. So everything, every item can be looked at that way. So expressive arts therapy is really a bridge from reality to the symbolic world of images and paintings and movements and everything that you can do with the creative process. And the objectives of the goals and objectives of creating an expressive arts process, like you see here, lots of examples that I brought, photo painting and Artful Book of Wonders, where we use books from the library, discarded books, another metaphor for rebuilding our lives and giving rebirth to something that it needs a lot of passion, a lot of work, a lot of love to transform and make into something beautiful. Recipes for Life, we make cards and we take letters of the alphabet and we use them to remind us of all the qualities that help us during our healing process. Oops, I skipped one. And again, these are all observations through my work with patients. So what they tell me when they go through the creative process and the different exercises. So there is a lot of awareness. It's a mindfulness practice. So they become aware of what they think, where they are, and what their desires are, their frustrations, and their qualities, their good qualities. They discover a lot of gifts, a lot of qualities while they do art.